Hi, my name is Jaimie Lee. I work at the Collaborative for Maternal and Infant Health at UNC Chapel Hill in the School of Medicine on a program called You Quit to Quit. It is a perinatal tobacco cessation and quality improvement project, and we offer free training and technical assistance on integrating tobacco cessation counseling into clinical practices. Today, I'm going to be talking to you about electronic cigarettes and other emerging tobacco products that your patients may be using. So I'm first going to describe tobacco use among women of reproductive age in North Carolina and its relationship with maternal and infant outcomes. I will talk about electronic nicotine delivery systems and other emerging tobacco products and their risks. And then I will show you some resources that are North Carolina specific that you can access free of charge that can help you when counseling your patients to quit using tobacco. So first, just want to talk a little bit about who's using tobacco in North Carolina. We know that tobacco use during pregnancy is directly associated with the top causes of infant mortality. And North Carolina's infant mortality rate is 41st in the nation. So it's definitely an area that we are hoping to improve in our state. And tobacco use is one modifiable risk factor that can really impact infant mortality. Tobacco use causes poor birth and infant outcomes. Before a woman becomes pregnant, if she's using tobacco, she's more likely to have issues with fertility, to suffer miscarriage, ectopic pregnancy. Her baby is also more likely to be born premature or low birth weight, and stillbirth is a higher risk for women who are using tobacco while they're pregnant. Babies who are exposed to tobacco in utero also have a higher risk of dying from SIDS. And they're at higher risk for other health conditions in infancy and childhood, including ear infections, respiratory infections, asthma, and all of these on the right-hand side are also exacerbated by secondhand smoke exposure. And there's also links with health outcomes further along in the life course, including childhood obesity, cancers, attention disorders like ADHD, and a higher risk for cardiovascular disease and diabetes in adulthood from the early exposure to tobacco. We know that about 1 in 12 babies in North Carolina are born to women who report smoking cigarettes during pregnancy. This is a question that's included on the birth certificate. The question is specific to smoking cigarettes. So this data is not capturing babies who are exposed to e-cigarettes or nicotine delivered in other ways. So while there are definitely improvements that we can make just in typical cigarette smoking during pregnancy, we know that there are likely women out there who are using other forms of nicotine delivery and exposing their unborn baby to nicotine and the harms associated with it. And this is an overview of women in North Carolina from the Behavioral Risk Factor Surveillance System. The purple bars are women who answered that they were a current cigarette smoker. We see typically that people with lower education and lower income are more likely to smoke cigarettes, and that women who are middle-aged are more likely to be smoking than younger women. But with e-cigarettes, the green bars, we see that younger women are more likely to have tried these products, which is pretty typical of what most people are seeing with youth and young adults being most likely to use these products. There's also a kind of reversal of trends in terms of education and income. So we're seeing women who have a higher level of education and higher income trying these electronic nicotine delivery systems. So these are people who, we wouldn't expect to be using a tobacco product based on the traditional trends of cigarette smoking, but they are trying these electronic products and in some cases using them regularly. So while our data a lot of times is focusing on cigarettes, we do know that there are many, many ways to deliver nicotine out there. And the tobacco industry is continually innovating to create more attractive and different ways to deliver nicotine. So some of the smokeless products, we've got chewing tobacco, which can come in loose leaf plugs or twists where you cut off a chunk of tobacco. You usually chew it up a bit and put it between your lip and your gum and absorb nicotine through the epithelial cells of your mouth. Dissolvable products, such as orbs and pellets, sticks and strips. These are products that you also take orally, so you can chew on the stick, suck on the orb or pellet or lozenge. The strips are like those breath freshening strips that you just place on your tongue and it will dissolve. All of these are made out of tobacco and deliver nicotine again through absorbing through the mouth. The dissolvables, unlike chewing tobacco, you don't have to spit out the liquid that comes from it. And that's the same with snus or pouches. These are also a spitless product. So the dissolvables and pouches can be more attractive to women just because they don't have to carry around a spit bottle or be spitting. The snus and pouches, the snus is a tobacco product where tobacco leaves have been ground up to a consistency like coffee grounds and then are in this tea bag like pouch, which you put it again between your lip and your gum, and the nicotine is absorbed just like with chewing tobacco through the epithelial cells in your mouth. Because there's not kind of free floating plant matter and it's all contained in the pouch, it's a little neater and can be more attractive to women than the traditional chewing tobacco. There are also new products on the market that are pouches that the inside of the pouch is, if you opened it up, it would just kind of look like a white powder. It would not look like tobacco leaves. And these are products like the Zen Pouches, and they're still nicotine. The nicotine is derived from tobacco, but it's not the tobacco leaves itself in the pouch. And those have just come on the market in the past couple of years. Other combustible products other than cigarettes, so hookah or water pipes, you've got a flavored tobacco cake that sits on top of a hot coal. The smoke is pulled through water in the bottom of that vase and then is sucked out through that hose. And so there are a lot of harmful chemicals coming from the charcoal and the tobacco. These chemicals are not filtered out by the water, although users might think that they are. And there's just exposure to a lot of carbon monoxide and harmful chemicals. So even if someone is using hookah on rare occasions, they should still be counseled about it because it is quite a large amount of exposure for one use. Cigars and cigarillos. These are tobacco products that where tobacco is wrapped inside of a tobacco leaf. That's why they're all kind of brown. Some of them are the large cigars you think of, usually men smoking, to celebrate something or whatever. And then there are these mini cigars or cigarillos that come in packs like a cigarette would. But people might be smoking a pack a day of these cigarillos, but not actually saying that they smoke cigarettes because there is a distinction. The other thing about cigars and cigarillos is they are still allowed to be flavored. So that can make them more popular products than traditional cigarettes. they did not, they were exempted from the flavor ban that banned flavored cigarettes several years ago. The kind of hot topic that we're going to dive a little deeper into today is electronic nicotine delivery systems. These are all the e-cigarettes and vaping products. So on the left-hand side, you can see a bunch of different types of e-cigarettes. I'll talk more specifically about how those work in a minute. The heat not burn systems, these are brand new. They just were approved by FDA to be marketed in the United States. And how they work is you've got a small stick of tobacco. It looks kind of like a cigarette that's been chopped in half. You load that into the electronic device and it heats it up, heats the tobacco up to a point where it creates an aerosol that can be inhaled, but it's not creating smoke. So it's not full combustion. So this reduces the amount of carbon monoxide and some of the other harmful constituents of tobacco smoke that the user is being exposed to, but you still have similar levels of nicotine and there are still harmful things that you're inhaling. It is not clean air that is being inhaled. So I want to dive a little deeper into electronic nicotine delivery systems. There are so many different products on the market, but they all work in basically the same way, where they have a battery that powers a heating element. Most of them have some sort of microprocessor that controls the heating element and tells it to turn on when a user inhales or when a user presses a button. It might also control like any kind of light or indicators on the device. And then the heating element, it heats up a liquid, which we call e-liquids. The e-liquids contain nicotine that's dissolved in propylene glycol or vegetable glycerin or some combination of the two. And then flavors are added into that liquid to create, whatever flavor the user has purchased to vape. The tobacco industry and the vaping industry, they did a really smart thing when they first came out with these products by calling them vaping products, because that gives the impression that what comes out of these products is harmless water vapor, or maybe it's water vapor with some nicotine and some natural flavors. But in reality, ENDS aerosol is not clean air. It has fine particulate matter that can be smaller even than the particulates in cigarette smoke and can penetrate the lungs even deeper. There's nicotine. There are heavy metals that are probably shed from the heating elements itself. There are volatile organic compounds that are produced when the flavorings or the propylene glycol are heated and react and create aldehydes. And then there are other compounds that I know that's kind of vague, but it really depends on the flavoring, the specific e-liquid, the specific device, how the device is being used, the temperature that is being, the liquid is being heated to aerosolize, the whatever the heating element is made of. It really depends. When you're testing e-cigarettes, you're really just testing one e-liquid and one e-cigarette at a time. So there's a lot of unknowns with e-cigarettes, and we just don't know all of the possible chemicals that can be in each combination. So here are some examples of ENDS products. When they first came out 10, 12 years ago, they were really marketed as a substitute to traditional smoking. And you can see that the devices really look like traditional cigarettes. They're small, cylindrical. They did have flavored cartridges at that time, but not the wide array, or wide variety of flavors that are available today for e-cigarettes. The second generation products, this is where kind of the recreational nature of vaping kind of took off, where you have these new types of devices where you fill up a tank with different flavored liquids, and you can choose from thousands of flavors. You can modify the device by changing out the heating coils. You can adjust the voltage on the device to change how much the liquid is heated, and therefore how much actual aerosol is produced. So this was kind of where vaping became more than just a substitute for traditional smoking. And then the most popular devices today are these smaller, discrete devices that have pod systems. And so these are all small enough that they can really fit in the palm of your hand. They used to come in flavors like the Juul came in flavors like mango, fruit medley, creme brulee, cucumber, which seems very strange, but that was a very popular one. There has since been a flavor ban limiting the number of flavors that are available, like for the Juul device. But yeah, these third generation products have made vaping more discreet and more popular, simpler and more popular among youth and young people. So speaking of youth and young adults, this infographic was released in 2018. I checked the most recent data from the CDC, and the numbers are very similar. So I wanted to keep this cute infographic. About 1 in 20 middle school students have used an e-cigarette in the past 30 days, and 1 in 5 high school students have used an e-cigarette. And we also have seen that a lot of the kids and young people who are picking up e-cigarettes, they have never smoked regular cigarettes before. And they would report that they wouldn't want to smoke cigarettes because we've done such a good job of educating about the harms of cigarettes and making young people really perceive them as kind of gross and unhealthy. But these flavored e-cigarette products are very popular, particularly among young people. And they're very easy to develop a dependency on. So you will probably be seeing more and more patients struggling with nicotine dependency from e-cigarette products in the years to come as some of these youth age up and are becoming young adults. I mentioned the Juul e-cigarette. At the end of 2020, it was 42% of the e-cigarette market, so it's still the most popular e-cigarette device. And people, when it came out and still to this day, really like this product because it was marketed to be hip and new. It wasn't called vaping, it was called Juuling. It uses nicotine salts rather than freebase nicotine, so it's a much smoother intake process, so you can actually vape more with less irritation. And it came in some great flavors. Originally, those have now been limited to just tobacco and menthol, but it's a very simple device to use, and also discreet. So that's one reason why it's been so popular. So I've mentioned the flavor ban, and the flavor ban was a response to the lung injuries that were vaping associated back in 2019. And that really restricted the flavors for the pre-filled products. And so those would be the products like Juul, where you have those little pods that you just you click in and click out. When one gets empty, you just replace it. However, the flavor ban did not ban the bottles of e-liquids that come in all kinds of flavors. And there are at least 15,000, probably more, of these e-liquids on the market. And those are the ones that you fill up the tank of a device and just refill it anytime it's empty. The other product that was also exempt from the flavor ban were disposable products like the Puff Bar. These still came in flavors like pineapple ice or grape and OMG, orange, mango, guava. These have since received letters from the FDA to stop selling and marketing because they have not met pre-market approval. However, they have been available, and a lot of youth had switched to using these types of products when their flavored jewel pods were no longer available. So what do we know about the health effects of e-cigarettes and other ENDS products? For reproductive aged women, the effects on particularly fertility and pregnancy have not really been adequately studied. But there are a few things that we know about e-cigarettes and the ingredients in them that can help us make some initial assumptions about the safety and risk of these products. So we do know that vegetable glycerin, propylene glycol, and flavoring compounds are all respiratory irritants. And they've been shown to cause airway and lung cell inflammation and damage, even cell death. So these, even without the nicotine, these products have the potential to damage the lungs. We know that nicotine is a reproductive toxicant and that it has adverse effects on fetal development, including lung and brain development, and that most of these products do contain nicotine. And back when they were first on the market, some researchers were doing studies to test if the low or no nicotine liquids still contained any nicotine. And even those that were marketed as being completely nicotine free did have some nicotine in them. We also know that the use of smokeless tobacco products like snus or chewing tobacco during pregnancy has been associated with preterm delivery, stillbirth, and infant apnea. So it's not the combustible cigarette smoke itself that necessarily causes all of the issues. It's some of the constituents that are even coming through smokeless products. And so we can kind of assume that some of these will be in the e-cigarettes as well. We also see that women seem to perceive e-cigarettes and ENDS products to be less harmful and less stigmatizing than cigarette use during pregnancy. So you may have women who are making a conscious decision to switch to e-cigarettes from traditional cigarettes when they become pregnant, not realizing that they're still harmful or that the nicotine is one of the main issues with using tobacco during pregnancy. Because we're still in a global pandemic, I just want to mention COVID-19. We know that smoking increases the risk for respiratory infections, it weakens the immune system, and it increases the risk of COPD, all of which can make COVID-19 worse. With vaping, because it's newer and we haven't had as long to study vaping and its impacts on health, the results are less conclusive, but we do know that the aerosols from e-cigarettes do harm the lungs. They irritate them and cause inflammation, and they can diminish the ability of the lung to respond to infection. So if you're vaping, it could mean that you are more likely to contract COVID-19. ENDS products are also a poison control issue. So if you do have patients who are using ENDS products, make sure you counsel them about storing their products, their e-liquids, their devices safely out of the reach of children. Nicotine is created by tobacco plants as a natural pesticide. So it is naturally a poisonous substance. It can cause some nice feelings in the human brain, but it is toxic. Even a teaspoon of liquid nicotine can be fatal to a 20-pound toddler. And the liquids often are, in wrappings or containers that make them look like candy. The flavorings that are added make them smell sweet. So they can be mistaken for candy and ingested by kids pretty easily. Nicotine is also absorbed through the skin. So if you get the liquid nicotine on your skin, or if a child does, it's absorbed and can also cause you to feel sick and can be quite dangerous. The most comprehensive report on e-cigarettes is from the National Academies of Sciences, Engineering, and Medicine. It was released in January of 2018. And I think a lot of studies are supporting some of the conclusions that were made, but a lot of the conclusions were that we just don't know enough yet, and we need more research. So some of the big takeaways from this report: e-cigarettes may or may not help adults quit smoking. It was determined there was insufficient evidence that they can help people quit smoking. It was very clear that e-cigarette use increases the likelihood that young people will smoke cigarettes. And I just saw a study released recently that definitely supports that conclusion. And lastly, the big picture and long-term health effects of e-cigarettes are still a question mark. We just don't know if they're safe. We don't know that switching from cigarettes to e-cigarettes will save lives in the long term. They're a new product, and we just don't know the long-term health effects of vaping and using electronic nicotine delivery systems. So what can you do if your patients are using these alternative products, maybe not smoking cigarettes, but are vaping? Well, the Public Health Service guidelines are very clear. Non-pregnant adults are more likely to quit when using a combination of counseling and pharmacotherapy. So the pharmacotherapy, there are 7 FDA-approved medications, including nicotine replacement therapies, varenicline or Chantix, and bupropion or Zyban. For pregnant women, you really can't, the pharmacotherapy has not been sufficiently tested for efficacy or for safety in pregnant patients. So you're really relying on behavioral intervention as the first line of treatment for pregnant women. Pharmacotherapy might be necessary for heavy tobacco users who are pregnant in order to help them quit. But for non-pregnant adults, you want to definitely utilize pharmacotherapy and counseling for pregnant women, starting with behavioral intervention. Behavioral intervention does make a difference. Brief counseling is going to work better than simple advice to quit. Brief counseling is going to work best for moderate smokers or tobacco users, so less than 20 cigarettes or a pack of cigarettes per day. And heavy users may need more intensive assistance and possibly pharmacotherapy to quit. So if you should be providing brief intervention counseling at every healthcare encounter on tobacco. You should screen for tobacco and address tobacco every time you see a patient. But some of your patients may need a referral to a tobacco cessation program or to a counselor or behavioral health provider who can provide them with more help to create a plan for quitting. The brief intervention that's best practice and evidence-based is called the 5 A's. And this is our 5 A's kind of algorithm chart that we've created at You Quit to Quit. For more information on 5A's counseling and the brief intervention, as well as motivational interviewing techniques, pharmacotherapy, including use during pregnancy and lactation, how to bill and be reimbursed for tobacco cessation counseling, how to access materials, and how to have a conversation with someone who's not ready to quit, but maybe they can reduce the amount they are using tobacco, or start to become more ready to commit to quitting. We cover all of these topics in our free training. The training's 90 minutes long. And we also offer free technical assistance on integrating tobacco cessation interventions into your clinical practice. So if that's something that you want to become better about with screening and counseling, then we can definitely provide technical assistance, also free of charge. Quitline NC is a great resource available to North Carolinians. Callers receive free help to quit tobacco from very highly trained quit coaches. And this includes electronic products. Some callers may receive free nicotine replacement therapy if they qualify. Quitline NC has also created a couple of special expanded protocols. One of interest is the Perinatal Protocol that offers more calls than the usual protocol, and also some more structured quit for people who maybe aren't ready to quit, but are thinking about quitting. And the people who are eligible for that are women who are planning to become pregnant in the next 3 months, pregnant women, lactating women, and women who are postpartum up to a year. Behavioral health protocol is a similar expanded protocol, and that's for people who have behavioral health conditions who are who believe that their behavioral health condition is going to impact their attempt to quit. Something new about Quitline is that you can enroll by text. So a patient can send the word ready to 200-400, and the Quitline will start the enrollment process via text message. You as a provider, you can proactively refer patients via fax or secure email to the Quitline, and then a quit coach will call that patient and get them enrolled in services if that patient chooses to participate. There's more information about the how to proactively refer patients using fax and secure email at quitlinenc.com, and there's a page for telework referrals. UQuit2Quit has developed patient education materials that are focused on pregnancy and parenting. We have a specific book for e-cigarettes and vaping. These are all available in English and Spanish and can be ordered for free through the Women's Health Branch. We also have this flyer that's got benefits of being tobacco-free on the front and facts about e-cigarettes on the back. These flyers have also been developed in printer-friendly versions on our website, uquit2quit.org. So we've got some black and white versions that won't use up all of your color ink if you want to print them in-house at your clinic. But you can order the full copy, full color copies from Women's Health Branch. The way you do that is you visit the Women's Health Branch website, their publications page, and they now have an online publications form using SurveyMonkey. So it's an easier process than it used to be when you had to fax in an order form. Our UQuit2Quit practice bulletin is available for order. It's a really great guide for how to integrate tobacco cessation counseling into your practice. It's got our 5A's algorithm, screening questions, some frequently asked questions about billing and billing for cessation counseling, a chart about pharmacotherapy and its use during pregnancy and lactation. So this is a great starting place that I highly recommend. You can access that on our website or order it from Women's Health Branch. Our website, youquit2quit.org, it has resources for health professionals. There's also pages designed for pregnant women, mothers, and families. So people who are thinking about quitting tobacco and maybe want some tips, or they just want to read up on it some more before they commit to quitting. I highly recommend checking out our webpage. And lastly, the You Quit to Quit team is a resource for you. My email and phone number is there, as well as the director of You Quit to Quit, Erin McLean. We're happy to help. You can email me if you would like to schedule a You Quit to Quit training, or if you have any questions. If you are looking for resources for patients and you're stuck or you don't have time, I can help you with that. Really, any training or technical assistance with tobacco use, screening, and cessation counseling, we are more than happy to help. And we'll have office hours for this presentation, and I'll be there to help answer any questions that you might have. Thank you.